Dr. Michelle Pennie with Bliss Dermatology and Wellness. So today I'm going to be talking about skin triggers for common and chronic skin conditions like rosacea, eczema, and psoriasis. So skin triggers are things that are in the environment. They may be external or internal that cause flares of chronic diseases. So it's important to know what these triggers are so that they can be avoided, potentially to reduce the flare of these diseases. Trigger number one is sun exposure and heat. So with many patients with inflammatory skin conditions, sun exposure and heat can worsen the skin condition. So it can cause increased redness, inflammation, and flushing. So sun exposure can be just daily sun exposure. It could be more intense sun exposure from a day at the beach. And then heat, so it can be from being in Florida, it's hot, saunas, hot tubs, anything that heats the skin. So important things to do to avoid these triggers, certainly with sun exposure, sun protection is the most important factor. So wearing sunscreen every day. We really like physical blockers that have a zinc oxide for great protection, but still tolerable for sensitive skin. Sun protective clothing, wide brim hats, and sunglasses. And then of course, seeking shade and avoiding that midday sun. For heat, trying to avoid very hot showers, saunas, hot tub, going out in the middle of a sunny summer day as well. Trigger number two is harsh ingredients in skincare products. Many skincare products have ingredients that can certainly aggravate and irritate people with chronic skin conditions. So fragrances, preservatives are common irritants. So it's really important if you have rosacea, eczema, that you look for products that are made for sensitive skin. Additionally, astringents or toners that contain alcohol can really dry and irritate the skin. Those scrubs that may feel good initially, but they can be totally harsh on the skin as well and break down that skin barrier and really irritate things. So if you have rosacea, eczema, psoriasis, you're prone to those things, your skincare regimen is really important just to minimize the triggers and keep your skin healthy. Trigger number three, stress. So it is a common question I get. Could the stress be causing my flare-up of my skin condition? And in many cases, yes, it can. So stress can certainly come out in our skin and increase our cortisol, increase inflammation in our body, and present itself with flare-ups of our skin conditions. So stress, while we would wish we could all eliminate or minimize it, there are definitely many things you can do to healthily manage stress. Daily exercise is wonderful. Doing yoga or meditation or mindfulness, working on breathing exercises. These are all things that can help you manage stress. So trigger number four is medications. So oftentimes there are medications that you may be taking for other issues that can actually be a trigger or a flare for your chronic skin issues. For example, blood pressure medications may cause flushing and that can worsen rosacea. There are some medications that can worsen acne. So it's really important in your skin evaluation and consultation to disclose and talk about any medications that you're on, including over-the-counter products, because those may be an important trigger for a flare of your skin condition. Of course, don't stop your prescription medications without consulting your physician. But certainly we can have a discussion if there's certain medications that may be problematic for your skin.